I'm joined by Dr. Darin Ingels from California. We have had Darin on the show before. Thank you for joining us today, Darin.
Oh, thank you for having me.
Now, you did a presentation for us for the LDN 2017 conference on Lyme disease. Could you tell us about your new book called The Lyme Solution?
Sure. Well, I had Lyme disease myself back in 2002, so I had the, experience of being a Lyme patient as much as a Lyme doctor. And the book was really kind of written out of my own experience of what I went through dealing with Lyme disease. And, I went down the typical path that most people do using antibiotics, and they helped me temporarily, but it just so happened I got infected 3 weeks before I opened my own practice. And when I opened, I was, the doctor, the bookkeeper, the receptionist, doing everything and working, very long days. And after about 8 months, I started to get symptoms again. And when I went back on antibiotics, it didn't help. And I changed antibiotics, and it didn't help. And I went through a cycle of about 8 or 9 months of changing antibiotic protocols and really got worse. So I was fortunate to have a handful of patients in my practice that had seen a doctor in New York City named Dr. Zhang, who's a doctor from China, a medical doctor who works as an acupuncturist. And he developed a line of Chinese herbal formulas. So I went to see him, and he started treating me. And really in about 3 or 4 weeks after starting the herbs, I was about 85% better. So I had a pretty significant turnaround just by, going on herbs. So it was really kind of my realization that, for myself and certainly for a lot of other people that, antibiotics have their place, but they also have their limitations. And I kind of had to go back to my naturopathic roots and, go back to, herbs and diet and lifestyle. So after applying what I did to myself to, thousands of other patients, I found that there was kind of a path that people could take to really, try and overcome Lyme. So, that's really what prompted me to write the book.
Mm-hmm. And do you start your book with describing about testing? Because so many different tests will come back negative, I believe.
Yeah, well, the testing has always been terrible. It's never been good. And I was a microbiologist before I was a doctor. I actually used to do this test for a living, so I have a lot of experience with it. And in really 40 years of research, we've really never changed the criteria of this test. And I don't think what a lot of people realize is that this test was never, ever designed to be diagnostic. It was really designed to monitor people that had known Lyme disease. And, at least in the U.S., if you go to the CDC's website, the Center for Disease Control, they tell you that Lyme disease is a clinical diagnosis. And I think that's pretty well known around the world. Yet so many doctors put stock into the testing as being really the definitive way that you diagnose somebody with Lyme disease. And unfortunately, it's just not true. It really is based on your signs, your symptoms, particularly if you happen to live in an area of the world that's endemic with Lyme, and you've kind of ruled out everything else. They call Lyme the great imitator or the great mimic. It looks like a lot of other things. So you have to go through and rule out other possibilities. But, when we see that people have a positive test, false positives are actually quite unusual. False negatives are extremely common. So a positive test gives you a pretty good idea that you probably had exposure, and a a negative test doesn't necessarily exclude the possibility. And I mean, I guess on the heels of that, the good news is that we are having new labs coming out that are testing in different ways. The gold standard for years has really just been this 2-tiered antibody test. And, an antibody test is really just measuring your immune response to exposure. So at best, all the test really tells you is you've been exposed. Mm-hmm. Whether you have Lyme disease or not really comes down to whether you ever actually expressed any of the symptoms. Because theoretically, you could have gotten bit by a tick that carries Lyme. Your immune system did what you wanted it to do. You never got Lyme disease, but you'll show evidence in your blood that you had exposure. So that's why you always have to take consideration the symptoms you experience in conjunction with the test, and you put 2 and 2 together. But like I said, the good news is we do have some new labs coming out that are starting to look at cytokine activity, which is not measuring antibodies. In fact, there's a lab in Germany called Armin Labs that does great testing for cytokine activity. And then there's a new lab that just came out in the U.S. where they look at a common sequence to all species of Borrelia. The test that's been out there has only really looked at Borrelia burgdorferi, which was the first strain of Lyme that we discovered. We now know that there's 300 strains of Borrelia worldwide, and yet the test only looks at one of them. So we now have a lab that's starting to look at a sequence that's common to all Borrelia. So I think these kind of labs, as they develop, will continue to increase our likelihood of picking up Lyme in people.
Mm-hmm. And you were saying about looking at the symptoms and how Lyme can mimic other conditions. So if you had the symptoms of MS and chronic fatigue syndrome, how would you try and rule out that it wasn't MS or chronic fatigue, that it was Lyme?
Well, I think in those two examples particular, it could be both. I think a lot of these diagnoses out there are really vague. I mean, even if it's MS or chronic fatigue or fibromyalgia, these are just sort of descriptive diagnoses without really an understanding of why. And if you ask your doctor, why do I have chronic fatigue? Why do I have fibromyalgia? More often than not, you're going to get kind of a blank stare. And I think, Lyme can be a trigger for MS. That's what happened to me. My Lyme turned into MS. And, if you talk to a radiologist, they'll tell you that the lesions you see on the brain with Lyme are identical to the lesions you see in MS. So, I think a lot of these diagnoses that tend to be kind of, vague or really without a specific understanding of, what the underlying cause is, Lyme and some of these co-infections particularly can be a trigger. And what's really interesting is if you go into the medical research, you'll find there's a tremendous amount of information about microbes as a whole being catalysts or triggers for autoimmune diseases. So it's not really, fringe medicine anymore that, different microbes, bacteria and viruses can cause a lot of these, chronic illnesses. And I think it's something that most doctors really just aren't trained to look for. But again, there are literally thousands and thousands of articles out there showing how, MS is a great example. We know that Lyme and MS have an association. We know that Epstein-Barr and MS have an association. We know that chronic fatigue has been associated with numerous viruses and other bacteria and so forth. So, I think it's just the process of trying to go through and identify, what these potential underlying microbes might be that are potentially triggering that reaction. Because if you know what the microbe is, there may be a way, whether it's an antibiotic, an herb, some other way to try and help deal with the infection. And if that really is the trigger, once you deal with the infection, often we find that the symptoms get a lot better.
Mm-hmm. And what about, there are different trains of thought that Lyme disease can be sexually transmitted. What's your take on that one?
Yeah, it's been a controversial topic. And what's really interesting, when I wrote the book, of course, I was doing a lot of research, and I was really surprised that in the research, they have not shown that it is sexually transmitted. And I think a lot of Lyme experts, in fact, I was at the ILADS meeting last October, and one of the gentlemen stood up and basically felt that it is very hard to acquire Lyme sexually, through sexual transmission. The way you get Lyme is through a tick bite, and of course, it's specifically in the saliva of the tick. That's the route of entry. So through sexual contact, the research says no. I don't think it's impossible. I certainly have had partners where one developed Lyme, and then months, years later, their partner developed Lyme. Now, is it because it's through sexual transmission, or is it just because they live in the same environment and that person just happened to get their own exposure? I think it's a bit of a gray area. Because it's really a kind of blood-borne pathogen, I think unless there's probably a transmission of blood, it might be fairly hard. However, there was an article that literally just came out last week that did find Borrelia in the genital secretions of both men and women. So I think that's some of the newer evidence that it's possible. But just because it's in the secretion doesn't mean that it can still, penetrate the mucous membrane and create an infection the way that we think of it, that you would normally get through a tick bite. So, I guess the truth is we really don't know. My advice to patients with Lyme is to be cautious with sexual activity, and use protective measurements. But I think we're still trying to figure out what that possibility really is.
Mm-hmm. And what do you cover in the chapters in your book?
So the book is really designed to be a patient guide. Of course, it's very appropriate for practitioners who really just want to learn more about Lyme and a sort of a natural way to approach it. But I really break it down into 5 steps to sort of simplify the plan. And the first step is really about addressing the gut. We know that the gut accounts for up to 80% of our immune function. So if the gut's not functioning well, often, the immune system doesn't function well. And many Lyme patients I work with, have a history of some sort of gastrointestinal problem even before they got Lyme, and whether it was chronic constipation or diarrhea or gas or bloating, there was some evidence that they really weren't assimilating their food well and that things weren't functioning quite the way it should. So I really talk about, different nutrients you can use to help, rebuild the gut, repair the gut if it's been damaged. Certainly for anyone who's already been on antibiotics that might have wiped out a lot of their normal gut flora, or perhaps they've been on other medication that's damaged the gut, such as, perhaps chemotherapy if they've been through cancer treatment. So it's really outlined and designed to give you a step-by-step plan on, different nutrients you can use to really help, restore the gut back to its normal balance. Mm-hmm. And then the second part of the plan is really about diet. So I've tried various diets on myself and certainly with my Lyme patients. And there's paleo and there's keto and there's, specific carbohydrate. There's just numerous diets out there that get purported to help, everything. And what I really found is what's called an alkaline diet seems to really work best for Lyme patients. And an alkaline diet is really kind of perhaps a hybrid of paleo in that, it really kind of reduces a lot of your carbohydrate intake. But what it really boils down to is, I think, is to what we probably ate when we really were true hunters and gatherers, where it really is a plant-based diet. So you're really eating mostly vegetables. And we try and limit animal protein to less than 20% of your total dietary intake for the week. And then there's certain foods that we know are just very acid-forming in the body. Those are things like dairy products and junk food, processed foods, which of course are a huge problem here in the U.S., and even things like coffee. What we know is from a chemical standpoint, the more acidic your body becomes, the more prone it is to inflammation. So at the end of the day, what the diet's really about is reducing inflammation in your body. And inflammation could be in your joints, it could be in your brain, it could be in your gut. It really applies everywhere. So I give you a 2-week, plan on, this is what you should be eating. And then I've actually partnered with a nutritionist at prepdish.com, and we put together a 1-month meal plan for people who really want to follow this diet through. And it just gives you some great recipes and easy to follow guidelines on how to prepare your food. A lot of times when people have Lyme, they're just tired and exhausted, and the last thing they really want to do is spend hours and hours slaving over a stove. So we really want to try and simplify it and just make it easy for people to really start eating well. The third step of the plan is about treating infection. And as I mentioned, I went through both antibiotics and herbs, and I found that herbs actually work really well. So I go through a series of herbal protocols I've used myself personally, and I've also used in my clinical practice that I find give me the best clinical results. And what I like about herbs, too, is that not only are they trying to go after the bug, but they're also dealing with all the other things that Lyme does to the body. So it's helping reduce inflammation and improve circulation and improve blood flow and help support your immune system. So it really deals with a lot of the things that Lyme does. And one of my contentions in the book is that Lyme initially is an infection, but at some point it really kind of becomes an autoimmune disease. And so if we really start thinking about Lyme more as an autoimmune problem than just a straight up infection, I think we get better clinical results. So I really walk you through step by step. Here's the herbs to take, here's the amount to take, and these herbs, at least in the U.S., are available online, so it's easy for people to get access to it. The fourth part of the plan is really about environment, and we know that a lot of people with any kind of chronic illness tend to have a high body burden of different chemicals and toxins, which all just makes it hard for your cells to work well, for your immune system to work well. So it's really about reducing your exposure at home to different chemicals that you might be using, as window cleaner and tile cleaner and bathroom cleaner. Most of these chemicals tend to be fairly toxic and have a lot of things that don't do anything good for your body. And I really focus a lot in this chapter about mold. Certainly here in the U.S. and then I'm guessing in the U.K. as well. You've got a lot of mold issues, and mold is the one thing I find mimics Lyme probably more than anything else. And if you write down all the symptoms of mold toxicity and all the symptoms of Lyme disease, there's quite a bit of overlap. So when we've had someone who's been on Lyme treatment and they haven't been responding very well, one of the first things that always pops in my head is mold, and do we need to go through that process of trying to identify if they've got mold exposure in their environment. But mold is definitely a big part of that environmental evaluation. Mm-hmm. And the fifth part of the plan is really about lifestyle. And I find so many people, again, when they're chronically sick, and certainly with chronic Lyme, a lot of lifestyle things really change. I used to be a very physically active person, and when I had Lyme, I was exhausted, and the thought of doing anything physical was just a lot. But moving your body is really very important for your physical health, for your mental health, and I think no matter what your physical state is, there's something you can do just to get you moving a little bit. And it could be as simple as stretching, it could be yoga, it could be Tai Chi, it could be Qigong, it could be swimming. There's a lot of low-impact activities that people can do to really try and get their body moving. And again, that's what helps move the blood, which ultimately moves the lymph, and the lymph is where a lot of these organisms like to hang out. So it really is kind of a way of cleaning out the toxic stuff in your body, bringing in oxygen, bringing in fresh nutrients. And I think it's also just good for people's mental health. I also talk about the importance of sleep. I find a lot of people after they've been exposed to Lyme really don't sleep very well. And sleep is, when your body actually gets the chance to restore and repair itself. So if people miss out on that deep restorative sleep, it's just really hard to get well. So I talk about specific nutrients that people can use to encourage deeper sleep, better sleep. And then the last part of that is really about stress management. Again, when you're chronically sick, it's stressful for you, it's stressful for your family, your loved ones. And I think there's so many people out there with Lyme that have a good support network, but I know how it was for myself. At some point, people kind of get tired of hearing about not feeling well, and they ask you, how you doing today? And you're polite and you say great, and deep down you don't feel great at all. Mm-hmm. But nobody really wants to hear your truth. So I think it's important that people have that place, that space that they can really share how they do feel. And whether it's a therapist, whether it's a Lyme support group, to have some avenue that's not your immediate family or friends that you can kind of unload on, and it's okay that you feel that way. Again, I think it's an important part of our mental well-being. And our brains and our bodies are very well connected. So if we're only taking care of our physical body and not our mental body, I think that becomes an obstacle to really getting well. So I just encourage people, and I give you some ideas in the book about different places that you can reach out and help kind of complete your support network. Mm-hmm. So that's really the essence of the book. And then I have one chapter in there is really our therapies that need to be physician guided. So of course I talk about low dose naltrexone and other therapies that need to be done under the auspice of a physician.
Mm-hmm. When you get somebody who comes to you, and we have many members that are so sick that they are disappointed, some of them, that they wake up the next morning because they have had enough. They feel so ill, they can't see any way out of feeling better. Now, if they read the book, where do they start? Because when you're that sick, to do anything is a struggle, as you were saying about following a diet for 4 weeks. There are many steps that you talked about there in the book. Where is the first point of starting to try and feel better, to be able to do all the things that you suggest?
Yeah, I think, kind of what the first step in the book is, kind of coming back to gut health. Your gut health, because that's your intestines, it's your stomach, it's your liver. Your liver is what does the heavy lifting for detoxification. And look, I've had patients that have gone through every therapy under the sun and nothing really worked for them. And sometimes they start, dealing with their gut or dealing with some sort of detox protocol. And then, that's the thing that really starts to get them feeling better. So, for someone who's really kind of down in the dumps and discouraged and just trying to find something to give a little shred of hope, I think, this is something, again, that's not expensive, that anybody can do, no matter what your state is, start, working on building your gut health, start working on, detoxifying your body. And, I've got patients that, do home enemas. I've got patients that, jump into a sauna if they have access. I've got people that, there are various ways that aren't, hard on the pocketbook, that are doable, that you can at least start that process. So I think that's a good place for people to start.
Because many people, as you were saying with Lyme, have tried so many different therapies, and it's financially broken them because, they spend a lot of money and many times don't feel any better than when they started. So to have a plan that you can follow through, and if you can get your gut health sorted out so you feel stronger and more able to do other things, has got to be the way. But if somebody came to you who was in a really bad way and they asked you the question, it may as well be how long is a piece of string, but how long would it be before, I start to feel better? And by following all these steps, could I put my Lyme disease into remission? What would you say?
Well, my expectation when people start following the plan, so to speak, my expectation is that you would see improvement in the first 6 to 8 weeks. Mm-hmm. Now, to get to a point where you really felt, completely 100% well, realistically, it could be a year or longer. For me, it was, after I got off antibiotics, it was a little over 2 years before I really felt like I got my life back. But again, when I started on the herbs, I felt an improvement, a significant improvement in the first month. So, I think just having that inkling that, you're feeling better, you're on the right track, then it's easier to kind of go forward and do, some of these other things. Where I see a lot of stuff fail, I think there's a lot of therapies out there that are very expensive, at least here in the U.S., that are really designed to target just killing the bug. And I think if that's the only thing that therapy is designed to do, you're going to get very limited improvement. And, I've seen, patients that have flown over to Germany for hyperthermia treatment. I've had a lot of people here who do ozone therapy and other oxidative therapies like hyperbaric oxygen, IV, ultraviolet stuff. And again, these therapies all have their place, but, they're really all designed in some way to kind of, kill the bug. And I don't know that they necessarily address a lot of these other issues that Lyme has created. And again, they tend to be very expensive, and you have to have a provider, apply these therapies. So, I wanted, the book to be really something anybody can do at home, no matter where you are in the world, pretty much, at least if you have access to the internet, and you can get some of these things. But a lot of these things are things you can really do on your own. And for a lot of people, it makes a huge difference. And again, this was my journey. This is what kind of turned the corner for me. I really never did any high-tech anything. Mm-hmm. It really wasn't accessible to where I was in the States at the time either. But I think, you have to look at the risk-benefit of any therapy and the cost, of course, and, what is going to give you the biggest bang for your buck. And I'm sure if you talk to every Lyme doctor out there, they'll probably have a different opinion on what that is. But again, I think the book that I've written is really a great way for people who are trying to be budget conscious to be able to sort through the therapies. I try to talk about, the price, about what these therapies are, so people have a pretty good idea about whether it's something they can do or not. But again, most of the stuff in there is pretty affordable.
Mm-hmm. Could I just ask you about long-term use of antibiotics? I know you were saying, you mentioned about how it affects your gut. I'm just thinking myself, when I was on a long-term antibiotic, I got thrush in my mouth and I could not clear it up. I had it for about a couple of months. It was terrible. Absolutely awful.
Yeah, the long-term antibiotics, even short-term antibiotics are going to have a damaging effect on your gut microbes. It's just the nature of the beast. You can't kill the bad guys without killing the good guys. So there's always going to be collateral damage when you're using antibiotics. And we know from the research in rats anyway, when you give a rat a single dose of antibiotic, I mean, that's not even one day, that's one dose. It takes 6 months for the rat gut to repopulate back to where it was prior to the antibiotic use. Mm-hmm. So I could only imagine what happens in humans when we've been on antibiotics for, weeks, months, and I mean, I've even had one patient who was on continuous antibiotics for 12 years.
Wow.
In addition to, wiping out your normal gut flora. And of course, again, we've had just a ton of research coming out about the importance of your microbiome and how it modulates not just your immune system, but your weight and your mood and, all these other aspects of our health are really tied into our gut microbes. The other thing about the long-term antibiotics that people really don't know about, and they should, is that it's very damaging to your mitochondria. And we know that Lyme itself damages your mitochondria. And for people who don't know, mitochondria are the part of your cell that literally create energy. So part of the reason, you're so darn tired when you get these chronic infections, and to a certain degree, it's that damaging effect to these mitochondria. Well, again, we know that when you're on antibiotics long-term, that compounds the problem and makes it worse. So, I'm certainly not opposed to using antibiotics. Again, I think they have their place, and certainly with acute Lyme disease, I think they can be very effective. But, if you're in the state of chronic Lyme and you've been on antibiotics for months to years and you're not feeling any better, I guess, my feeling is, at what point do you draw a line in the sand and say, this really isn't the best path for me and I need to find something different, knowing that in the effort to try and kill the Lyme, you're also damaging other really important aspects of your own body. Mm-hmm. So, it makes it even more confusing that, we don't even know if you ever really get rid of Lyme. We can't measure Lyme easily in the body, and I think there's been some pretty compelling evidence that we have never actually do get rid of Lyme. Once you get it, it's kind of part of you. But I sort of equate it to like, when you get chicken pox when you're 5 years old, you can get shingles when you're 55 years old. Mm-hmm. And it's the same virus that stays in your body. The difference is your immune system. Something happens that, it tanks, and then that virus becomes opportunistic. I think, again, we need to think about Lyme disease and how it affects your terrain. And if we can correct your terrain, correct your immune system, it should be able to keep it at bay. And not cause problems. Why is it there are some people who get Lyme and, they get over it and they're fine, and other people, it goes on for years. I'm sure there's a lot of reasons, but I think a big part of that is certainly what was going on in the body prior to getting Lyme and then what happened thereafter. Mm-hmm. But again, I think the more we make our body more toxic, more acidic, all these things just kind of add up, and it just makes it harder to get well. And of course, the antibiotics are also very acid forming in the body. So again, from a chemical standpoint, it's not doing the kind of things in the body we really want. So, people really need to weigh that risk benefit when they're considering doing long-term antibiotics. And, I've seen, I heard from people online and said, oh gosh, look, I was on antibiotics and it saved my life. Great, I think anything that works, again, there are some people who do really very well on it and it changes their life, and that's wonderful. But again, I think, I'm focusing more on the people who've been down that path that haven't responded well or gotten worse, and they need, other solutions.
Great. Well, we've come to the end of the show, and if people would like to go to dariningelsnd.com, he has a lovely website there with all the information about the book, his practice. There's a blog, a store, events, absolutely everything. And you can even order the book online. So it's been amazing having you with us today. And thank you so much for sharing your experience with us.
Great. Thank you, Linda.